The BVI Cancer Center is observing Breast Cancer Awareness Month this October. President Gloria Foy stated in a recent appearance on Talking Points that the events for this month would be somewhat scaled back. Foy believes it's more important that they get messages out to the public, noting the many cases of this disease in the territory.
We're not doing t-shirts at all. We're not doing the t-shirts at all. So we're going to be doing normal bucket drives, and we're going to the different schools or the different businesses that invite us out to talk, because we find that is more important, getting that message out there. And I tell people all the time, it's not all about the money. It's getting that message out. Early detection save lives. We can't say enough, because I'm to my desk every day, and the amount of calls coming in, and some of these cancers could be prevented.
The Rotary Club of Tortola is partnering with the BVI Cancer Society for this year's observance. Past President Abigail O'Neill recently spoke about the club's cancer screening project.
We have been for some years raising funds to establish a cancer screening project fund, which will tackle screenings for out of annuals, extraordinary situations, as well as education about healthy living and certain cancers, certain lifestyle choices that could in effect cause cancers in the most prevalent cases in the BVI. So naturally, as Rotary believes, we have to partner with organizations out there in our communities that are doing this work already in whatever avenue of service it is, so we can enhance the work that's being done instead of trying to reinvent the wheel when we're not necessarily the experts at it. So this month upcoming is Breast Cancer Awareness Month, and we know all of the wonderful work that Gloria and her team have been doing for decades. And we said, let's partner. And especially because it's such a high profile visibility awareness campaign, let's partner and see what we can do together for this month and this particular cancer, and then beyond that. Okay. So that's where we are.
Meanwhile, Dr. Charlon Lewis emphasized the importance of a cancer registry in the BVI and the need for persons to access proper care. Dr. Lewis stated that people are very secretive when accessing healthcare.
And it's not just being private, it's not just wanting to keep your information to yourself. A lot of times people will have conditions going on. First of all, they don't say anything to anybody. They might have, it's just a little ache, a little pain, and they really don't want to, go to the doctor to check it out, whatever the case is, because they don't want anybody to know. Or when they get the diagnosis, their first instinct is to, to go away and not to be treated here. They don't want the business on the streets, or whatever the case is. But I would say that in the Rotary Club of Tortola, partnering with BVI HSA, what we're trying to do is to make people more comfortable with seeking care locally. Now, I know, and as you rightfully said, yes, I used to work with BVI HSA, and I know that, BVI HSA, they do a lot of really great work. They are they keep saying, the only accredited, medical institution in the territory. And we're really happy to pair with them because they have some really good experts working with them. I know we found out that there's a cancer screening clinic that's going on as well. So even though they can come to their GP and they can get their mammograms done, once they find something on the mammogram, then what's the next step? Very often, you would have to do like an ultrasound. Sometimes you have to do a CT scan. And really and truly, it should be up to the experts to decide, especially having to do a CT scan, Gloria, because then you're exposing to more, radiation. And it really depends on the specialist to kind of send them for that. And like I said, in BVI HSA, they have a lot of really good doctors. And I very often actually refer my patients to them to try and get further investigations and then management done. But I think one of the things with NHI that I think people don't realize is how much we actually have available here on island, and we still have this mentality that, if you want the best care, you have to go off island. There's a lot that can be done right here. Every month NHI is coming out of vast majority of people's salaries, and they still don't go and get, their wellness checks done or their cancer screening done, because they still have in their mind, I think, that going to the doctor is so expensive. But I think, Gloria, and we can attest to the fact that not going to the doctor is even more expensive.
Yeah.
Because by the time you don't go and something has
painful.
and something has gone on so far, then you almost miss the mark. So whether it's having the cancer registry or chronic disease registry, like having statistics is very important. And I know Harmony singing to the choir when she's talking to us. But people don't realize that those numbers are important. We have to know the origins. As you were asking me what's causing it in our community, I could speculate about a lot of different things, but I don't actually know, because I don't know all the figures for all the cancers that we have. It could be based on location. It could be based on their diet. We don't know because we don't have that information. This is where registry becomes very important.